Hi, everyone. Welcome and thanks for joining us today. As some of you might know, this session is part of our summer webinar series, really focusing around how can you adjust your workflows and figure out how to streamline some of your HR aspects, gaps that you might have that need to be corrected, and really just how to tighten up these HR policies that you have as we head into fall. So that's really what we're focusing this summer on these series. We know that maybe there's some downtime, vacations are being taken, and so this is a great time to focus on getting these things adjusted. And overtime is definitely something that everyone can revisit and tighten up. This is one of those things that a lot of people might think that they understand, but it is definitely a complex compliance aspect because of all of the nuances that we're going to dive in today. And there's a lot of like assumptions that are made around overtime of maybe my policy says I don't have to pay overtime, so I don't, or there's a lot of nuances in your practice based on patients that are coming in and you have to still see them and that runs over. And so there's a lot of assumptions and then some mistakes in the math that can be made when calculating overtime. And so this is definitely a problem, of course, because we don't want you to overpay people. We don't want you to underpay people. And overtime happens. Like we know that that's happening in the practices that we're working with. We know it's a huge pain point to try to kind of get under control and really have structure around. And again, because schedules can get a little wonky, there are chances that maybe your overtime calculations are not accurate. And so that's really what we're going to dive into today. And again, a lot of employers and even employees assume that overtime is just time and a half after maybe 8 hours in a workday or 40 hours in a work week, and that's it. And so that's one of the misconceptions that can actually be an exception to the rule. And so we're going to get into those details in just a bit. But really, the main gist here is that getting overtime wrong can be expensive. And so you can see here in these stats, last year, the Department of Labor returned $126 million to employees, and that's just on unpaid overtime wages. So that's not even counting possible fines, damages, lawyer fees. There's even criminal penalties that can come into that. And so the reality is there were over 100,000 overtime cases filed just last year. And these expenses can really add up. And maybe on this webinar, some of you have fallen into that and unfortunately had to go and do some back pay. And so we really want to help to address that so that employees are getting paid correctly, you're protected from the employer manager level, and that everything is really kosher. And on the other side, overpaying for overtime can also be really costly. And so in some situations, you might be assuming that you need to pay overtime, but in reality, it might not be required. And no employee is going to complain that there's too much money on their paycheck. And so when payroll is complicated, like let's say you have an employee who does multiple types of work at multiple rates of pay, there are times where maybe you're paying more than you need to, or again, you're underpaying. And so the really big elephant in the room we want to address is how do we stop paying overtime if we don't need to, and how do we make sure we're doing it correctly? And where we come in as HR for Health is really making sure that those hours are paid correctly and that it's not confusing to you or the employees so that you're not overpaying or again ending up out of compliance by underpaying. So what we're going to dive into today, we are going to be doing a little bit of math. I will be doing most of the math so you can kind of follow along. But before we do that, we want to go over what actually triggers overtime. And it's not necessarily just as simple as I worked late. There are different nuances that come in. And then this leads right into understanding who's actually eligible to get overtime. So depending on the type of work they do, their pay structure, their classification, we're going to dive into that. And then we see practice owners making mistakes that can be really costly, one way or the other. So again, we're going to bust some of those myths that we hear as really common scenarios and questions from people that maybe aren't clients of ours yet, or as they become clients, these are a lot of questions they have as they're starting to use our time clock and understand how that works. And so because there's so many specific criteria for overtime and common misconceptions, a lot of payroll professionals and even some payroll platforms just can't handle it. So we want to go through what to review and kind of audit in your current systems if you're not using HR for Health's time clock to make sure that things are being handled correctly. And then, of course, we're built to handle a lot of these nuances. We have built our time clock specifically for dental healthcare practices because of the nuances of how uniquely you might pay employees. And so we'll talk about how to kind of keep that all in line and straight so that there's no questions, or at least not too many questions around it. Speaking of questions, as we go through this, please feel free to submit your questions into the chat box, into the Q&A, and we will try to get to them towards the end of this webinar. If not, we will absolutely follow up with you individually if we're not able to get to the questions. And then if you're listening to this as a recording later on and you have questions, you can always email hello@hrforhealth.com. I'll show that on the last slide as well, some contact info if you have questions. But again, hello@hrforhealth.com is also a way to be able to get a hold of us. So let's jump into it of what overtime is and isn't, because a lot of the times we hear practice owners, managers thinking that there are loopholes, that because of the way practices are run, that there's some special circumstances that allow us to not pay overtime. And that's not always the case. So we hear a lot from doctors saying, I told them not to work extra, or they're on salary so they don't qualify for overtime, or we're just too small of a business for the FLSA rules to apply. And so we really want to debunk those and make sure that you know what overtime is and what it isn't. So in the simplest scenario, overtime is paid at time and a half, 1.5 times of the employee's regular rate of pay. And in most states, it's triggered when an employee works more than 40 hours in a week. And theoretically, there's no federal limit to the number of hours that can be worked in a day. So somebody can work 24 hours and there's no law around saying that they can't do it. However, there are 3 states where working beyond 8 hours in a day equals daily overtime. So these states, Alaska, California, and Nevada even has some additional provisions around that. But those states, if you work over 40 hours in a week or over 8 hours in a day, those are considered overtime hours. And then in Colorado, the daily threshold is 12 hours in a day. So if an employee goes over 12 hours in a day, they're entitled to double pay for that time. So then in addition to federal law, you're also responsible typically to follow the law, of course, where the state of where the work is performed. So this is relevant if a non-exempt employee, which we're going to dive into what a non-exempt employee is in just a second, but if a non-exempt employee is based in one location, one state, and maybe they're sent to a conference taking place in another state, and that conference is required, so you are requiring them to go to that event, meaning they need to be paid for that. Where the work is actually taking place is what the rules fall into. So again, if you're in Massachusetts, but you send somebody to California for an event while they're in California, that we have to take those overtime rules into consideration. Again, if people are working across multiple locations and there are different rules across those locations, you want to take that into consideration. And then we have to pay the minimum wage, of course, can't be anything lower than the minimum wage at the rate that you're paying them at. And then overtime is based off of that rate. So again, we're going to get into the math, but just keep that in mind of rule of thumb is wherever they're actually performing that work is what state laws you have to follow. And of course, this is a lot to take in. That's why we track all the state level laws, even if they do change often, but we make sure that you're aware of what those things are. So what's also important to mention here is that there's a lot of ways that employees can exceed those thresholds. So those extra hours, like before and after their shifts, if they work through lunch, again, attending trainings, conferences that are mandatory, if they're on call, if they're traveling between practices, those are, just one more thing that you do need to take into consideration to count when we're looking at how we calculate overtime. The other thing that's really important to understand is kind of a base of our formulas that we're looking at is understanding that we're looking at hours within a given work week. So it doesn't matter what your pay period is, it's what your work week is when it comes to calculating overtime. You can define what your work week is. So most practices, what is really typical is that a work week starts on Monday and it runs through Sunday. It's just has to be 7 consecutive days, and these are consistent. We don't change around our work weeks. This is a set thing. So again, you can decide what you want your work week to be. If you're open on Saturdays and Sundays, it might not make sense to have your work week be Monday through Sunday. But again, that's going to be our threshold for what we look at when we have to do that overtime calculation. So it's not based on your pay periods, it is based on your work week. The only thing that you cannot do when you're defining your work week is try to adjust it retroactively to avoid paying overtime. So that's really kind of the only parameters around it. Again, it can be Saturday through the following Friday. It can be a whole stretch of different ways that you structure that. Typically, again, it's either like a Sunday through Saturday, a Monday through Sunday that establishes your work week. If you have questions on that, please let us know. We can kind of direct you how to understand what your work week is and how to register that as your business. But if an employee is entitled to overtime within that work week, you must pay it. So that work week is going to look at, do they work more than 40 hours in that work week? And that might be different from within your payrolls. Maybe one work week they did work overtime, the second work week they didn't. You don't have to blend those 2 weeks. We just look at it at a week by week basis. Another question that we do get a lot of should be taken into consideration when calculating overtime is if somebody takes like PTO, vacation, or sick hours in that work week, and that puts them over 40 hours, does that need to factor in when you're considering calculating overtime? And the answer to that is no. So it's just the hours that they work within that work week. And if they work more than 40 hours, then overtime does come into play. If they go over 40 hours because they take days off and that's already approved, those aren't worked hours, so you don't have to worry about those hours. So now, which employees are actually eligible for overtime, and what do we have to look at when we're calculating this? So I think that this is a really nice chart to kind of lay out what it means to be exempt or non-exempt, because that's really what our basis is when we are deciding or figuring out if overtime is eligible for somebody. So a lot of practices we see fall into the trap of confusing salary with exemption. So just because you pay somebody a salary, meaning a set rate every pay period, regardless of how many hours they work, that doesn't necessarily mean that they are an exempt employee. So the things you need to consider when understanding if somebody is exempt is their pay structure. So in order for somebody to be exempt, they do have to be paid a salary, but salaried employees are usually considered exempt from overtime, like I said, these exempt employees. But it's really about their job duties that we have to look at that's really important, because salaried exempt employees tend to manage their own workload. So even if that ends up being more than 40 hours a week, they don't get paid overtime. But a non-exempt employee is doing certain tasks at certain times. So they are not exempt from overtime. And a really easy way to kind of think about this, because it is rare that somebody can be exempt in the environments that we're in a dental office and an optometry practice. It is rare because salaried exempt employees are going to be your doctors, your dentists, your managers, people that are performing supervisory or professional work that's appropriate for an exempt employee. So again, quick test for yourself is if they don't fall under the professional exemption, which is the doctors, dentists, that sort of thing, the other employees we're looking at is, do they have business making decisions? Are they able to work autonomously? Do they have hiring and firing decisions? Do they manage more than one employee? So I might be describing you as an office manager if you're on this call, or your office manager. Those are typically the only people in the offices that can be classified as exempt, other than high earners, dentists, that sort of thing. So non-exempt workers are receptionists, dental assistants, lab techs, opticians, hygienists. They are all considered non-exempt employees, meaning they're eligible for overtime. They are not exempt from overtime. And the reason we have to define both the payment structure and the job duties is to protect the non-exempt employees, because their skills are in demand and overtime helps prevent them from being overworked and undercompensated. That's kind of the logic around this. So this also ties into the timekeeping criteria. So exempt employees on a salary do not have to track their time. They can, but they don't have to, because again, overtime, lunches, breaks, they are exempt from those things. They're not relevant to them. So if you want to track your exempt employees' time, you absolutely can. That's more just from like a tracking perspective. It's not like legally required. Whereas non-exempt employees do have to have their time tracked. This makes sure that they're fairly compensated for all of their work. They're taking their meal and rest breaks. And as an employer, it is your responsibility to maintain those logs of how they're tracking their time. So it is essential that all these non-exempt employees are clocking in and out. The other thing to keep an eye on for pay from an exempt perspective is that there is a salary threshold. So even if they're on a salary, if their pay is under the current federal threshold, which is $43,888 a year, they can be eligible for overtime. These rates change constantly. It's also very much granular on the state and local level. So essentially, the exempt salary has to be twice minimum wage. So depending on where you're located, if you're in California, that salary threshold is going to be much higher for an exempt employee, because we have a lot of local minimum wage requirements. Our state minimum wage is higher versus other states that just default to the federal minimum wage. So these are all the things that you need to look at. Again, typically we see that most practices are paying at the salary threshold, but that's like these employees don't hit the other criteria of their actual job duties being considered exempt employees. So again, that's where we want to think about, okay, how do we bring in these overtime calculations to make sure that it's correct? So looking at, are people classified correctly first and foremost is going to be a big point of making sure that everything is correct. So here's where the math starts to come in. So again, like I mentioned, the law states that any hours worked over 40 in a work week must be paid at 1.5 times the employee's regular rate of pay. So common misconception that we see here is that somebody's regular rate of pay, we're just looking at their hourly rate, but that's not in actuality how it works. An employee's regular rate of pay includes multiple things that count towards what this regular rate of pay is. So what I mean by that is regular hourly wages. So this includes any secondary rates of pay for working in a different job role or attending a CE class. A lot of people are surprised to even find out they are able to pay a different rate for doing different roles or going to a training course. And you just have to have it in writing. And it can't be below minimum wage. We recommend typically for CE unit or for CE classes or conferences or lunch and learns, anything that's out of their normal job role, that you establish it's going to be 70% of their typical rate of what they're usually paid for their job role. You'll pay them at 70% of that for their time spent towards that. That allows it if there's wage discrepancies across different team members, meaning like your front office person maybe makes $10 an hour less than your assistants or your hygienists, you don't have to just set one rate for everybody. You are saying it's 70% of their rate, of their normal rate. So all of those regular hourly wages have to be included when we're doing this calculation. Another thing that a lot of practices don't realize is that non-discretionary bonuses have to also be included when we're doing this calculation. So the definition of a non-discretionary bonus is it's not discretionary. So a discretionary bonus is I'm feeling super friendly today. I'm going to give you $100 extra. The employee doesn't know what they did to earn that. They just, you were happy and you gave them a bonus, maybe a Christmas bonus. It's again, they don't know what they did to get it. It's just a discretionary amount. Whereas non-discretionary bonuses, the employee does X to get Y. So think of like attendance bonuses or percent production, percent collection, performance-based bonuses of I'm doing XYZ to get a bonus. It's set for them. And the reason why non-discretionary bonuses have to be considered when we're doing an overtime calculation is because the logic there is they're working towards that bonus while they're working. And so they're trying to avoid, the government is trying to avoid underpaying employees to then just have overpay them on the bonus side. So it's trying to make sure that it's fair there. So non-discretionary bonuses do need to be taken into consideration. Again, commissions. This one might not be as common for you. Maybe, again, from an optometry perspective, if your team is selling frames, that sort of thing, this would be considered in that. And they do need to be factored into overtime calculations. And then shift differentials. So extra pay for like night shifts or holidays. Like non-discretionary bonuses, these are known. By the employee and they do apply to a specific time period, so they need to be included in there. So now that we can see how this number could vary from week to week, and it's not just the hourly rate that's going to give you an accurate measurement of what counts towards overtime, we need to make sure that you're considering these because these are like the accidental loopholes that result in overpayment or underpayment. So this on the right-hand side of the screen is the formula, and we'll revisit this in just a little bit, but this is essentially how you are going to get that calculation to know what that total pay should be for their payroll. And this is where a lot of mistakes come in because this calculation can be complex depending on how many factors you have coming in. If you have all of these factors of multiple rates of pay, non-discretionary bonuses, shift differentials, it can get a little bit complex. And so what I want to also kind of dive into is some of the patterns and mistakes that we see before clients start working with us that are must-haves like to kind of fix in those workflow errors because it's leaving these gaps again where you might be underpaying or overpaying. So these are kind of the common mistakes, misconceptions that could help prevent unnecessary overtime. So first one is the multiple rates of pay. So the question is, how do you figure out an employee's rate of pay when they work multiple roles at multiple rates all in the same work week? Because again, we're looking at it per work week. And again, some practices have employees at different rates of pay depending on what they're doing. So you might have a dental hygienist who is paid while they're doing hygiene work, but might get paid a different amount if they're doing administrative work, or again, if they're going to a CE class. That's a big one too, is for any employees that are non-exempt that you might be paying a secondary rate for like attending conferences, those lunch and learns, and they're required. So those events are required for an employee to go to. You do have to pay them. You can pay them at a lower rate, again, as long as it's not lower than minimum wage. You can pay them than their normal rate, pay them lower than that. But then we have to do kind of this blended calculation called weighted average. So it does make overtime a little bit more complicated, but this is really the way to break it out. So using this formula to figure out their new hourly rate is necessary because this is going to help you figure out what that regular rate of pay is before calculating the overtime. So again, we have to figure out what's our base of it might not just be $25 an hour because they have multiple rates. So we need to figure out what that base rate is to know what to pay the time and a half based on. Using the highest or the lowest rate of pay for overtime calculations could cause you to underpay, which is absolutely a compliance risk, but it also can result in you overpaying. So you have the option, if people have two different rates of pay, let's say one rate of pay is at $25 an hour and one rate of pay is at $30 an hour. If they go into overtime while working that week, you can decide to either do the weighted average, which is a blended rate to figure out their overtime rate of that $25 an hour and $30 an hour, or you can pay overtime on the highest rate of pay. So overtime would just always default to being time and a half of $30. You just can't say, well, overtime's always going to be based on that $25 an hour. Again, it either needs to be that blended rate of the $25 and the $30 an hour, or it just needs to be time and a half of that $30 an hour. So this is, again, one of a really common mistake that we see. And a lot of practices are like, well, just forget it. I'm not going to pay them different rates of pay. And I would recommend not to do that, because there are systems out there that can make these calculations really easy, or you just need to be paying attention to it and make sure you're not, again, overpaying or underpaying. Another really common mistake that we see is a lot of practices pay payroll on a semi-monthly basis. So I pay payroll on the first of the month and the 15th of the month. And this is where some sneaky unpaid hours can start to fall through the cracks, because the most common way that hours can start to slip through the cracks is if your semi-monthly pay period does not align perfectly with your work week. Because remember, we're looking at the work week to do those calculations. Really easy fix to this is you pay on biweekly pay periods. I know there's pros and cons to that from a cash flow perspective. You have a couple more payrolls in the year if you are paying on a biweekly schedule. But if you're paying on a biweekly schedule, you can always align for those work weeks to begin and end with your biweekly cycle. So pay cycle. So that's why we recommend to do that. But it's really up to you. If you want to continue to pay on a semi-monthly pay period basis, you just need to be conscious of ghost hours being able to happen. What we call it is ghost hours. And this is when employees might forget to clock in, or you don't realize that in the last work week that you closed payroll out for, maybe that payroll closed out on a Wednesday of the week. There was still 2 more days in that work week where they started to accrue overtime, but your payroll system isn't catching that those hours from the previous pay period might need to be considered when doing that overtime calculation. So this is why accurate timesheets are so important, so that if you do need to go back and do those calculations, you can do that really clearly so that they're properly paid and you're in compliance with those hourly employees. Again, HR for Health does automate this for you, but if you are not in our system or using our time clock yet, you do need to be aware of these things if you have a semi-monthly pay period. Another common mistake, working through lunch. So a break is a break, right? If anything, if there is a break taken between 5 minutes and 20 minutes within a day, that is still considered work time. They are paid for that. But anything over 30 minutes in a day, they can clock out and be unpaid for those hours. What happens though is that there's more work that can actually fit into the day. Like, we've all been there. Patients run over, this happens. But if non-exempt employees work through their mandated breaks, you do owe them. So unpaid breaks need to be real breaks where employees are relieved of all duties. This does make things like lunch and learns a little bit sticky. Like, if you are requiring, if that lunch and learn is mandatory, you do need to pay for it, but that can result in overtime. And so what we recommend is really lean on those lunches, and have them clock out for a 30-minute lunch before they go into the lunch and learn. I know that might seem counterintuitive, but this is a really kind of focal point of how to reduce overtime, is making sure, again, even if a patient runs long, you're still having those employees clock out, be fully relieved of all their duties for at least 30 minutes, maybe even an hour if that's what's normal in your practice, but don't let them skip those things because that's what adds up these times. And then also, again, for those lunch and learns, having them clock out before that lunch and learn. And if you're wondering of what makes a training mandatory, the Department of Labor kind of has a test to check if something is considered mandatory. So if you say yes to any of the following, then it should be paid, which the training is done during normal working hours. It's mandatory or even strongly encouraged. It's directly related to the employee's job, or the employee performs any kind of work during the training hours. So if you answer yes to any of those, that training would be considered mandatory. Again, thinking about if you're doing a lunch and learn right next to the front desk and the phone rings and your receptionist gets up to go and answer that, they definitely are working during that. So you want to make sure that if it's truly not required, you don't have to pay them. But if there's any instance of those criteria, you want to lean on the side of paying them. And again, you can pay them a secondary rate because they're not doing their normal job duty while in those trainings. And it's important to remember here that it's not about like intention. So if you tell them not to work extra hours or not work through lunch and they do, you still have to pay. So, and again, if you strongly suggest training, but on paper you're writing it's optional, but it's really implied that it's not optional, you want to make sure you're paying for that time. So again, anything that you should have known that a non-exempt employee is working, any of those hours you should have known they're working, you need to pay for it. And then these are really kind of the special circumstances, I'm going to call them, which is a lot of, again, we are in different environments than other businesses in our practices. And so we sometimes have these misconceptions of, well, I'm different, I'm special, I don't have to pay this. And so, again, one of the most common mistakes that we see is just trying to put everybody on a salary to avoid paying overtime. So, as I mentioned earlier, that just paying somebody on a salary does not make them exempt from overtime. They have to actually, their job duties have to reflect that they are an exempt individual. So if right now you're thinking to yourself, oh, I do have everyone in the office paid on as a salary and I'm not paying overtime, you definitely should be talking with us so we can help you figure out how to address that. You have different options of kind of how to true that up and get things correct, but you definitely don't want to ignore it. Big mistake to just say, I pay everybody salary, so I don't have to pay overtime. Another mistake that we see is if you pay employees, let's say you pay them on a daily rate. So you come in, you get $500 a day. We do see practices making the mistake of not tracking that person's time. It's kind of similar to salary, where we don't have them clocking in and out because we just pay them a straight daily rate, and then not doing the calculation if they go into overtime based on their daily rate. But then on the flip side, what we hear practices asking us is, well, I pay them $500 a day, but then if they leave, I deduct time for their pay. So you're kind of double dipping in that, which isn't kosher. If you say you're going to pay them $500 for a day and they work two less hours, you still need to pay them that full amount. And again, if they go into overtime, you need to make sure you're doing those calculations, which we'll kind of walk through in a second. Another super, super common one is doctors telling us or practices telling us, my policy says I do not pay overtime, so I don't pay overtime. That's their fault if they go into overtime. They're not allowed to do that. And unfortunately, that's just not how it works. Doesn't matter if your policy, it doesn't matter what you have in writing, the overtime laws still apply that if an employee works overtime, that they need to be paid for overtime. However, where we do see practices sometimes not realizing there's gaps in this is you can absolutely hold employees accountable for going into overtime if it's not authorized. Your overtime policy should state that if an employee needs to work overtime, and you define what that means. Maybe it's 10 minutes past, up to 10 minutes, they have flexibility. Anything over 10 minutes of overtime, they need to get approval. But you should have in your policies that they're communicating to you that they need to work overtime and that you're approving it. If that doesn't happen, where they don't ask you and you don't approve it, that doesn't mean that you withhold the pay from their paycheck. That's not how we want to hold them accountable for that scenario. You want to write them up. I guarantee you, we see this all the time. That first time that you write an employee up, they realize, oh, this person is paying attention to it. Versus if you're just withholding on the paycheck, it's creating that resentment. You're setting yourself up for a really risky scenario. It's the last thing that you want to do. So going back and checking your policies to see, do I have accountability aspects in there of what does need to happen if overtime needs to be worked, and making sure I'm aware of that and not just seeing it when it comes to time to process payroll. Okay, so we're going to do a little bit of a pop quiz. If you want to kind of follow along and do the math with me, I'll give you a second to read this slide of the scenario. We picked really easy numbers to keep the math clean for this. But in this scenario, the employee is normally works 40 hours per week at $10 an hour. Last work week, he worked 50 hours because schedule ran long, so 10 hours of overtime in that week. And then he also earned a $50 non-discretionary bonus for perfect attendance. And he spent 3 hours taking an online course. So how much does Alex need to be paid? We have a lot of different factors in here. So let's work through the calculations. With Alex working $10 an hour, he worked 50 hours this week. That's $500. Then he also had a $50 performance-based bonus, so that's $550. However, those classes he took were optional. If you noticed, it was a graphic design class. Not sure how that necessarily relates to his role. So those actually don't count. That was optional. So we're just looking at that $550. The 50 hours that they worked at $10 per hour plus the $50 bonus. So we're going to take that $550 and divide that by the 50 hours worked in that week. So that's $11 per hour. We've now figured out Alex's regular rate of pay for this week. Only this week, because remember, we have to do this per work week to look at. But for this work week, we now know that his regular rate of pay is $11 an hour. So then we need to figure out how much extra he's going to earn this week for overtime. So we know that he worked a total of 50 hours, which is 10 hours over the 40 hours in the week of the federal threshold. So 10 hours, those 10 overtime hours, times $11 per hour is $110. And then we divide that in half, because this is the overtime premium pay that gets added, not the total pay. We already established the 1 of that 1.5 in that $11. And so the 10 hours is just based on, we're going to divide that in half because it's the 0.5 remaining that needs to be paid. That total comes out to $55. So now we need to look at the total pay. Now that we have his straight time earnings, that's already been established. That's the $550. Then we add that to the overtime premium of $55 that we established in the middle formula. That brings his total earnings to $605. So in this scenario, a lot of practice owners would have made the mistake of simply giving Alex time and a half for those 10 overtime hours and then paying the bonus separately. And if that happened, we would have been shorting Alex on his paycheck by $5. So that might not seem a lot. $5, great. That can't even buy a cup of coffee these days. But making this mistake over and over can lead to a lot of issues. And so you don't, again, on the bright side, it's not like you're paying a ton of extra money when you're factoring in your non-discretionary bonuses, but fines and penalties of not paying that correctly add up. This can accrue a lot over time. So you want to make sure you're doing it correct in real time. So I completely understand if your head is spinning a little bit, that's okay. Let's just talk about kind of how you can use some systems to address this can of worms that can be overtime. Because again, there's so many variables, exceptions, exemptions, specific situations. It sometimes is hard for standard payroll systems to be able to do these calculations. So without the tools or using the wrong tools, overtime can be kind of like a guesstimation. So A lot of systems we see can't even calculate it properly when bonuses and multiple rates of pay are involved. Again, thinking about like your payroll company isn't really worried about your compliance. They're just supposed to make sure the paycheck is paid correctly based on the information you're giving them of what should be on that paycheck. So it requires in a lot of situations for you to do manual calculations to get to your payroll company. And then that, of course, opens up mistakes, inconsistencies, confusion for you and the employee. And it's just stressful for you and your team every time you run payroll. And then of course, if there's ever an audit, you're going to need to be able to provide records to prove compliance. And so remember, there were millions of dollars paid back last year with over 100,000 overtime complaints because there were holes in these processes. And we really don't want you to be one of them. So again, that's why we were built. If you're a current client and you're not using our time clock, highly recommend reaching out to our team to get introduced to that, because our system understands all of these complexities and it's already built in there. It's not like you have to pay extra to get it. It's part of what HR for Health is offering you, but we are going to automatically do weighted average calculations for you, the bonus adjustments, being able to pay those multiple rates of pay, and basing it all on where you're located, those state specific rules. And again, those things might change over time, but we update our system. Like we will build that into our system. It's our software. It's not something that we're white labeling. This is something that we're tailoring specific to your needs. Those required meal and rest breaks are always going to be scheduled, measured, and we're not going to let overtime go without you knowing about it. We send you a report every single day that tells you if people are still clocked in, if they're working overtime. But again, if you pay people per patient or per day or percent per collection, percent per production, all of that stuff is stuff we calculate for you. So again, if you end up getting audited, you need that information. Your records are going to be stored like when you need them. So if you're not a client, or maybe you are a client and you just have some homework to do, here are kind of the things I would highly recommend that you audit right now. So again, in a perfect world, payroll is just going to work with the correct numbers every week, but we know that's not realistic. So because we can't eliminate the possibility of overtime completely, this self-audit can kind of help you to understand what's working well and what's not. So reviewing which of your employees are exempt and which are non-exempt, and making sure that they're doing the right type of work for their status. And again, as an asterisk to that, if as you're doing this exercise, you realize you are underpaying people, you should have been paying overtime, please, please, please reach out to us so we can support you on how to address that situation so that you get protected as quickly as possible there and we get things fixed. And then making sure that your timekeeping system, again, if you're not using HR for Health, is able to accommodate your complex pay structures that come into play so that they can automatically do those weighted average calculations and those non-discretionary bonus calculations if you're offering those things is really important. And then also reviewing those rules about what time should be paid. So paid trainings, making sure all your team is getting their legally mandated breaks if you're in a state where that's required, kind of looking at your scheduling. Am I scheduling this in my days in a way that is leading to unnecessary overtime or not allowing employees to take those lunches and breaks that can help? Am I allowing them to clock in and then go get their coffee, put on their makeup, check their phone, or am I making sure they clock in when they're actually ready to work? Again, another thing, if you don't have this turned on with HR for Health, there is a way to get alerted in real time if somebody clocks in too early, if they clock in late. So we're giving you those triggers so you can stay on top of it like in real time. But this is where I would start of looking at these three things. And if any of them are not working out, then this is where we definitely want you to reach out so we can help you. So if you want to scan this QR code, this will actually book a demo with our team. This is the hello@hrforhealth.com I mentioned at the top of the webinar where you can reach out if you have questions. And then we're also offering a free overtime audit ebook, basically. So we're going to automatically send that to you in the follow-up email with this recording. So you can review that and kind of see where your practice stands right now. So all of this will be available to you. Again, you can scan the QR code, call our team, email our team. If you're a current client and want to get certain things set up, we'll help with that. If you're not a client and want to understand more about how timekeeping works, please reach out to our team. And as we wrap up, this is our next session in our summer series, which I'm going to be talking about how to lower turnover. We know that this is a really big pain point, and how to be able to compete for talent without having to raise somebody's hourly rate. So again, you can scan the QR code here, register for that webinar. If you're not able to make it live, we'll always send you the recording. But I really appreciate you guys joining us today. Please give us feedback on questions you might have, so we can really tailor this content to you. But looking forward to seeing everybody in a couple weeks.
And we do have a couple questions for you, Jill, if you
Okay.
want to take those.
Sure.
Okay. First one, it's from Betsy Whitmore. Here's the question. If we typically pay quarterly and holiday bonuses at different dates through the year to show general appreciation of staff, is that a discretionary bonus?
It sounds like yes, it would be discretionary as long as it's not related to like hard performance metrics. Meaning, I understand generally speaking, either the practice is doing well or maybe we're not doing as well, and so we don't have as much money for the bonus. But if it's truly they don't really know how they're earning it and they don't know what the amount is going to be, that's typically safe as a discretionary bonus. If they know exactly the structure of, if I schedule 20 new patients this week, I get a $100 kicker, that would be a non-discretionary bonus. So it depends how structured it is and how much information you give them about the bonus and how much they know they're working towards that bonus.
Awesome. And then one more from Chris Caseman. We have an employee that is salary paid. He is a supervisor of a department, but he also performs work/service. Is he eligible for overtime?
I would have a follow-up question for you on what the work/service is. And so maybe for that one, Jasmine, we can have our team reach out directly so we don't derail other people, but we'll make sure, Chris, that you get the answer to that. We just need a little bit more details to be able to accurately advise you.
Awesome. And then one more from Gina. Do the bonuses calculate between discretionary versus non-discretionary bonus when setting it up in HR for Health?
Yes, you will set it as a setting for if a bonus is discretionary or if it's non-discretionary. If you mark it as non-discretionary, it's going to ask you the date range that bonus was earned in. So let's say you pay a quarterly bonus and we have to go back and look at January through March to pay that bonus in April. We'll select those dates, and then the system is going to scrub every single work week, all of those timesheets within that, to make sure that the non-discretionary is calculated correctly. And then again, if you mark it as discretionary, then it's just going to pay the bonus flat. It doesn't need to go back and reference those timesheets to do the calculations.
Yeah, and Gina is just asking how to get that done. Gina, we'll get you connected with the operations team to make sure that you can get the support you need.
Oh, Gina, I'm so happy. Yes, we want to make sure you use those features. So we will reach out and make sure that's all set up for you.
Awesome. And unless anyone else wants to send in any more last minute questions, that is everything for today.
Amazing. Well, we'll see everybody in a couple weeks for our next webinar, and thank you so much for being here.
Thanks so much, everyone. Jonah, yes, we'll get you over to the team as well. Thank you. Awesome.